Hello, friends, and welcome back to another episode of the Concussion Nerds podcast. Today, we are joined with Dr. Rachel again. Welcome back.
Thank you. Thank you.
I'm going to dive into something super quick. For those of you on a healing journey, I know I normally talk to clinicians a lot, but on a healing journey, we are relaunching our Concussion mini school program. And the exciting part about this is it is now completely free. There is not another resource that I know of on the internet that gives you everything that mini school gives you at zero cost. Really quickly, what is it? It is a private community of other mini schoolers who've been on this journey and are on this journey with you, so you don't have to explain crap. You get 2 live calls with me a month in the group format. Every month we have different topics, and then we always open the floor to questions and Q&A. And you have a resource video library full of topics and past calls already waiting for you to make your way through. There's calls on dysautonomia in there, on exercise intolerance, on the vestibular system, on setting boundaries, on how to start to build your healthcare team. There's so much information waiting for you, and it's all free. So below in the show notes, you can find the link. Come join us. Truly, it's a beautiful adjunct to whatever else you're doing to help you continue to move forward on this healing journey. Okay. Today, we are talking about returning to sport after concussion. And it's a question we get asked all the time, how quickly can I return to play? What does this look like? And so Dr. Rachel is super passionate about, this is one of the reasons you became.
Yeah.
Right?
It is. Yeah.
So we're going to go into what you do. But Rachel, what was it like for you? Soccer, right?
Yeah. Soccer.
Yeah. What was it like for you when you had to return to sport?
Yeah.
Played soccer.
I think the main thing, it was primarily based on symptoms. So if you were asymptomatic and if you describe not having any symptoms, you could pretty easily return to sport kind of that day or within the next couple days.
So
there was a little bit of like balance testing or coordination testing, which, let's be honest, most people could pass that even if they do have a concussion. A lot of it was just based on subjective symptoms.
So were you ever that athlete that just wanted to get on that field and play and maybe weren't super truthful about the symptoms you had?
Regretfully, yes. And I think sports is difficult, right? Because it is a high pressure environment and it does go off a lot of the pressures you maybe feel from yourself or the people around you, your coaches, etc.
Okay, so no, I love that. So let's actually talk about those pressures. Yeah. So what are those pressures?
Yeah.
Because I played fastball.
Yeah.
And it was not like at a super high competitive level. So for me, the pressure that you would feel as a university athlete, as like an elite athlete, does not apply to my life.
That is fair. That is fair.
So sometimes I know clinicians are like, well, like you only have one brain.
Yeah.
Right.
Sure.
Which we know. But can you share like what are some of those I actually read a study about some of these too. I was like, what is this?
Yes.
What actually are some of those pressures you experienced and that you think athletes experience that drive this, like, I need to be there. I need to be back in.
Yeah. I think that for me, at least, there's both those internal pressures and the external ones where everyone's situation is a little bit different. But in university, there's much more players that are signed to a team than can actually play or dress or start, right? And so when you're in that position and you find yourself dressing or starting and then you get a concussion or a hit on the head, it's those voices of, well, do I tell the truth about my symptoms and then have to sit out, potentially have difficulties kind of getting back into that lineup? The coach has increased confidence in other players that have now kind of shown themselves and kind of fit into the team. When I have this opportunity, right? And it's like, that's what you're doing every single day is kind of fighting for that starting position. And I think internally that can be difficult, especially 10 years ago. The research also wasn't really there. So it wasn't talked about as much. The coaches or the support staff or the people in the environment, I think, didn't take it as seriously as people are starting to now. And so without those conversations happening, it's easy to brush over and not really take seriously yourself the implications of rushing back into it too quickly. And then it's also the external pressure from the coaches where you might be vying for a playoff position. You might be X, Y, and Z, and they want you in, right? If you're a top player, they don't want to lose you and they don't want to have to replace you with someone else. And I think sometimes there can be that hush hush about you're fine, keep going, and the traditional sports attitude of just like suck it up and push through it, which you only have one brain. So
I know when I was reading this study that kind of looked at the top however many reasons why athletes will, I don't remember them all now, but the other one was the pressure from the parents.
Yeah.
And if you're a parent listening to this, I'm just going to say, give your head a shake and remember that it's your kid.
Yeah.
And I've been the therapist that the parent is living out the dreams through their child.
For sure.
And we both have.
Yeah.
Right? Like we've both treated those clients. And that pressure on that child is insane.
It's a lot. Yeah.
And I completely just, no. So at Symphony, we do a lot of education, as you well know.
Yes.
We do a lot of education talks with some of the local sport organizations.
Mm-hmm.
So then the question always comes up about baseline testing. We'll talk about baseline testing on this episode too, because it's so interweaved with sport. But I've put a hard stop for the clinic perspective on we won't do baseline testing unless your organization also does
for sure.
an education session with the players, coaches, and parents. Because I believe that the baseline testing is useless if you don't know how to use it, number one. But two, if you don't understand concussion, if you don't understand the implications, if you don't understand what to do, then you're no further forward. And so we've lost contracts with baseline testing before because they didn't want to do an education piece. Yeah. But that's my hard line for our clinic.
For sure.
Yeah. So let's kind of talk into, so you could fib.
Yep.
You know, a little white lie.
Yeah.
Put my brain at risk.
Yeah.
And kind of get back into play. But let's talk about what we try to have, like, what does it look like today? Because this is what we don't encourage today.
For
and
sure.
The beautiful thing is pending people are following the right protocols. Yeah. It's not all based on symptoms anymore.
No, it shouldn't be.
And let's just like hit the biggest myth, I think, on the head is that just because your symptoms are gone doesn't mean your brain has healed.
Yep. And I think I've heard you say this on the podcast a couple of times, but we say this to all of our clients, right? Where we're treating them and first visit, we tell them like, there's going to be a point in this process and in your recovery where you are going to hate me because you feel fine. You might feel like you are asymptomatic, like you can do it all. You can be back out there on whatever your sport or activity is. And objectively, you might not be there yet. Right. And that's important, I think, to be upfront with them as well, to be like, this is what we're looking at. This is why it's important. And symptoms don't always align with the objective facts of if your brain and your nervous system is ready.
Yeah. And I think we all say that because the beautiful part is then when that time hits, because it always does, we can we say, so remember when I told you there was going to be this time when you didn't like me? Yeah. And they're always like, I'm like, it's right now.
It's happening.
This is now. And then it's always that, like, I need you to trust that I have your best interest at heart. And I need you to trust that I'm going to get you back on that pitch, that field, that ice, whatever sport we're talking about, as quickly as I can. But my number one priority is that you were doing it safely.
For sure.
And I would say, like, because we prime them that way, they might be pissed. And they usually are super frustrated, but they still stick with us.
Yeah, for sure.
Because we've been up front. And I think sometimes like setting that stage in that initial appointment of what to expect, especially for anybody, but especially an athlete who is driven to get back on that field, is so important.
100%.
You know, it's that piece of it. Normally, I think when we get this point too, it's within a week or two that you're cleared back to play after.
Yeah.
It's really not that much longer in that I think like my clinical practice.
Yeah, especially if they're coming in early, right? Like if we're seeing them in the first 3 to 5 days, then there is, a high likelihood that they're going to recover quickly, right?
Yeah. So this kid wasn't an athlete, but I'm just going to like preface this with, so this was a few weeks ago in the clinic and we literally got inundated with acute concussions.
Yes.
It was crazy. And this one kid comes in, I call him a kid. He's 30 years old, but he's younger than me. So he's a kid. And he sits in front of me and he'd been referred from our emergency department. And he was like, I haven't had symptoms for like the last 3 days. And I was like, and you're still here.
Mhm.
He's like, I just want to make sure, like, I want it to be better to say the story. I'm like, I wish everyone had his mindset. Anyways, we're doing his testing. The brain, you guys, it's such a marvelous, marvelous thing. It has the ability to compensate. So when people talk about, I've had
Yeah.
concussions before and I was totally fine. Well, it's the question of, did you actually recover or did you compensate? Was
Yeah.
your brain able to step up and take the place and do the work of the part of the brain that was injured?
Yeah.
Because it can do that and you can feel totally normal up to a point. And so I assessed this kid and like he's doing his oculomotor, like he's doing really great. And then I put him on our force platform and have him close his eyes. He almost fell over. So when you did it, he had fell into that vestibular profile of concussion. But we caught it so early and other things were going so well, we could rehab him. He was discharged within 2 weeks.
Yeah.
Like he crushed it.
Yeah.
Like he was a beautiful example of, I actually feel really good. I have no symptoms, but I wanted to be safe.
Mhm.
And so if you're listening to this, it's why we're such an advocate for, if you heard Rachel already say it, like, especially if we get people in 3 to 5 days, that's our goal window.
Yeah.
Right. If you have a concussion, whether it's right now, whether it's from any reason of having a concussion, get into a concussion specific clinic within 3 to 5 days. And we say that because the research over and over and over and over again at this point, this is not just us preaching, this is like in the literature, evidence-based, shows us that the sooner you can connect with a concussion specific clinic, the better the trajectory and speed of your recovery. And that number that they put in the research is under 7 days. And then there was another study that actually showed that people who didn't go to a concussion clinic at like the 30-day point, it didn't matter what they did before if it wasn't a concussion specific clinic, that time frame still had significant impact on the length of their recovery. So let's go into, I'm playing on the field, I get a concussion. Let's walk through what this looks like.
For sure.
This will be really interesting to see if Rachel and I are on the same page.
What it should look like or what it does look like? I think those are also two very different.
Okay. In an ideal world, if we could guide our client from start to finish, let's talk about what this return to play ideally looks like. So that if you are also listening to this and you are an athlete or you're the parent of an athlete, if you're not somewhat following this path, and I'll give an example here in a second too, that you start asking questions. Okay. So first of all, we are so upfront with our clients. We are so transparent. We are so honest. We actually were just talking about this in our concussion media school call. You have every right to be able to ask your therapist, what is the treatment plan? What are we working on here? And that therapist should be able to outline this for you pretty dang clearly. And if they can't, yellow flag. Or no, red flag. That's a red flag.
Yeah, that's a big red flag.
That's a big red flag. If they can't tell you what they've identified and what you're working on, find a new therapist. Bold statement, but I stand by it.
That could be another big tangent, but yes, I stand by it too.
That's all we're going to say on that
one.
So we hope that as we continue, we're 14 minutes in already, that this can kind of also be like a guide for you to know what to expect. So let's say Johnny, 15-year-old, whatever it is. So we're going to factor in return to play here. Gets a concussion. It's not a suspected concussion. We know it's a concussion. Step one, what do we do?
So on the field, sorry?
Okay, well, let's say it's on the field. Yeah. So let's say like he takes a hit, goes down, he gets up, he gives like the little head shake. Yes, I love that new symbol. Like the new, like he gives the head shake. He's a little bit unsteady on his feet. He starts complaining of light sensitivity and headache. So like we know it's a concussion. Right? What happens on the field?
So on the field, right, like obviously you don't have all of the tools to look into it quite as specifically as we would want to in a clinic setting. But I think that there should be a way to screen at least for each of the concussion phenotypes, right? So checking the cervical spine, checking balance, checking vestibular system vision, etc., at least a baseline level there, right? So not just asking about symptoms, but let's rule out red flags as well, right? So is this an emergency response where we have to go to the hospital, or is it less so of emergency, right? So check pupils, check neck, check all of these things along with asking for symptoms.
So I'm going to counter this with you. Do you think, we'll see if we agree or disagree. Do you think, because remembering, like, if this is, for a lot of these people, these are volunteers.
Yeah, for sure.
right? And they
Yeah.
definitely don't.
They don't have the
They have a
same
little bit.
capacity.
So
Yeah.
do you think it's actually important that they are able to identify phenotypes, or do you think they just need to identify the potential risk of a concussion and red flags?
Red flags. Yeah.
Right?
Yeah.
So
Yeah, I think it depends
but
on the environment, right? Like if you're talking about like a high level sports team where they do have those athletic trainers that are actually trained in concussion assessment and treatment, then that's one thing. But if it's little Johnny, 15-year-old boy who's on a rec team and, like you said, volunteers, then the most important thing is screening for red flags and being able to diagnose a concussion.
yeah, and I think what you did say though is like we need to give them the tools to
Yeah.
understand. So like
Yeah.
the balance, like that
Yeah.
piece of things. So I think for me, the biggest thing on that sideline or
Yeah.
on the court or whatever it is, and that first is the ability to have the skill set
Yeah.
with the tools that we give you. The SCAT-6 is a pretty typical sideline assessment for those listening. There's also a lot of apps that help you guide you through that sideline assessment. The biggest thing is to be able to identify concussion and remove from play.
For sure. Yeah.
Right? And red flags.
Is it safe for this kid to continue or not?
Yeah. And then I would say, like, for so many of those pieces, it's that, so if you identify that concussion, you pull them from play.
Yeah.
Depending on their symptomology, you may have to pull them from the stadium, like they may have to go.
Mm-hmm.
Obviously, what are the red flags?
Yeah, well, so obviously the more severe red flags would be symptoms such as severe pounding headaches, inability to speak or properly put sentences together, any significant changes to vision, etc.
Posturing,
Yeah.
vomiting,
Yeah.
worsening neck pain,
Mm-hmm.
clear fluid coming from the nose or the ears. Those are
Big
like
red flags. Yeah.
call 911
Yeah.
and go to the hospital. But if it's not that, which over 50% of concussions actually don't go to the hospital,
Yeah.
then the old thing is we have to wake you up every 2 hours. What we want you to do is you need to stay awake for 4 to 6.
Mm-hmm.
And you need to stay awake for 4 to 6 hours because if a red flag were to develop, then you can catch it, right? So we're thinking like if there was a bleed, a slow bleed. So over that time frame, you would start to see someone with worsening like levels of consciousness, feeling more lethargic, more groggy, more tired. If that starts to develop over those hours, then again, off to the hospital you go. Yeah. So you don't want to let someone sleep in those first 4 to 6 hours. But after that, if red flags have been cleared, let them sleep.
You need to recover.
Right? Like sleep is such a healing thing. And so the old, like I have to wake them up every 2 hours, that was so that we could potentially would catch if something was wrong. But we don't have to do that anymore. Yeah. So you pull the athlete from play, you got to go to the hospital, you go home. First 24 to 48 hours, like every concussion, complete physical and cognitive rest. So I got a really good question of like, well, what does that actually look like?
Mm-hmm. Yeah.
Right.
Because it's not just doing nothing, right? Whereas I think the old conversation was, well, that means the first 2 days you're just sitting in a dark room. Yeah. Which we know is going to do more harm than good.
Yeah. And so I think for me, the way I was talking to this client is rest is the things that you can do that do not flare your symptoms in those first 2 days. So like we do not want you flaring symptoms. So if you can listen to an audiobook, everyone always gives the example of an audiobook. Okay. I don't listen to audiobooks.
No, me neither.
I would like go batshit crazy if you told me to listen to an audiobook. So if I were resting and I was like, well, everyone says rest is an audiobook. So I put an audiobook on, but one of your symptoms is sound sensitivity or you're having difficulty processing auditory information and that audiobook starts to increase your headache, well, then that's not rest, right? You might be someone that actually sleeps off and on for 2 days. Totally fine. Totally fine. You may love reading. For some people, reading does not bother them at all after a concussion. Yeah. If it doesn't bother you, it doesn't flare your symptoms, it's an activity that you can do. But also because we love the nervous system over here too, this is where we really do want you to include things that like some breathing. And so there's actually been some research that has come out to show there's so many different breathing techniques out there, but some really great effectiveness in terms of the nervous system and stuff with the 1-to-2 ratio, which just means your exhale is twice as long as your inhale. We love meditation for helping calm the nervous system. Again, if you can listen to it, right? Getting outside and putting your feet in nature and just like being in the sunshine or like being in the like whatever. So rest, because someone really asked me this the other day and I was like, okay, how do I actually explain this? Because I don't want to just tell them to lay on their couch all day. Rest is an activity with minimal stimulation in the first 2 days that doesn't flare your symptoms.
For sure. You don't want to just take away any and all stimulation, right? And I think that there is that important piece of your brain still having to process and take in, whether it's something visually or auditory, etc. But yeah, it should be you're managing, right? You're doing things that you can do without any symptom flare up that aren't going to make you feel terrible or symptoms at all. And it's tricky, right? Because you kind of have to figure out, hey, what is it that I can tolerate? Like you said, is it a book? Is it an audiobook? Is it a walk? Whatever that may be, if you're able to get your body moving a bit and still tolerate some sort of cognitive or physical load within your tolerable range, then that's great.
Yeah. So that's the very beginning, right? Then the next piece is honestly getting into a concussion clinic.
Mhm.
We love it when people show up on day 3 or 4. Like,
Yeah.
that is
It's the
so
best.
good. It's the best. Because then what will happen there is that we will do that deeper assessment. So you heard Rachel talk about, this profiles. This is important because here's the thing. Over 50% of it, and this is not to scare you guys, but over 50% of individuals develop persistent concussion symptoms. Now, that number is less in the sport world.
Mhm.
It is absolutely less in the sport world. It is closer to the probably more 30%, I think, at least we see clinically. And so persistent symptoms means it's taking months to recover as opposed to weeks to recover. But here's the thing. Here's how you decrease the risk of that happening. One, you get into a clinic early. Okay. So this is why you keep hearing us talk about day 3, day 4, under day 7.
Yeah, ideally.
Right. But then 2 is actually addressing what the heck the concussion has impacted in your brain.
Yep.
Which means a proper screen of the profiles so that we can target your treatment. If we miss or we completely neglect 2 or 3 of the profiles, then we haven't done our job to identify truly how this concussion has impacted you, and we are not fully individualizing your treatment.
For sure.
So when you come into the clinic in day 3, let's say ideally, less than day 7, that's where your therapist is going to do that more full system screen to be screening for those different profiles. And so remember, there's 7 of them, right? So we have, this is where I always fuck it up, cognitive, cervical, vestibular, ocular, physiologic / autonomic,
Headache.
affective, and headache. And affective is mood.
Mm-hmm.
So we're going to screen for those 7. And then based on those 7 is where we're going to give you targeted treatment. Mm-hmm. But the other thing we really want to be having you do starting on day 3, exercise.
Movement.
Right? Movement, exercise, what that is going to do. Oh my gosh. So I was just telling Dr. Rachel, I had this amazing conversation with this lovely lady on Instagram. And there is an episode on the podcast back in the beginning that talks about how you begin to exercise after an acute concussion. And I sent her this yesterday. Again, let's go back to the research over and over and over again. Supports movement.
Yep.
Aerobic exercise. Day 3 is when you can start this to help expedite the healing process. How many studies now? I can't even keep track.
Too many.
Right?
Too many.
And this poor girl is 10 weeks out and no one has given her information on how to exercise. And her body, oh my gosh, her body is craving. She's an athlete. Her body's craving it so bad right now. And she's like, can I do this? And I was like, yes.
Please do.
Sent her the podcast link and I said, please listen to this. Yeah. Absolutely want to get you moving. So day 3, you're going to you're going to do the clinic. You're going to screen for those assessment profiles. We're going to get you moving. So when we're getting someone moving, right, there's parameters, guys. It's not just go walk for 20 minutes, super quick. What are we looking for in that movement?
Yeah. So very broad overview. We still do some sort of exercise testing when the individual comes into the clinic, right, to see at what heart rate do they start to have symptoms and what can they tolerate. And then we provide that, again, individualized kind of exercise protocol for them where we give them very specific target heart rate ranges, very specific time there or duration to spend within that range. And then, an activity, exactly, one that's going to, if they have certain postural demands, etc., that meets their needs and their nervous system's needs. But then we're also giving them the education of the guidelines of, hey, if we cannot do this step without aggravating symptoms, we do not move on. Right. And so just like everything, whether it's the exercise portion or other neurotherapeutic exercises, it's the education around, hey, this is supposed to be asymptomatic, right? So that we can continue to progress and recover and not go the opposite direction.
I will say that acute exercise portion, we do
Yeah.
let our clients push into a little
little
bit of
bit.
symptom increase with the very
Strict
clear
guidelines.
instruction
Yeah.
that you have to be back to your baseline within an hour after.
Yeah.
If you're
And no
not,
more than 2 points,
and no
right?
more than 2 points. And if that's not happening, then we're scaling back.
Mhm.
Return to sport, if we're going to talk about this, it's a 6-phase process.
Yeah.
Right? So step 1 is trying to just do like regular activities in the house we talked about. Step 2 is that light aerobic activity. And depending on the actual return to sport protocol you look at now, they've split this, I think it's into 2A and 2B.
Okay.
So 2A will be like the below like 50% of heart rate, or target heart rate. And then 2B is pushing into that upper part of heart rate. And that might be the moderate activity part. And then it moves into sport specific training. And then it moves into non-contact practice. And then it moves into contact practice. So there is absolutely a stepwise protocol as a framework that our athletes need to move through. But I will say for us, to clear the exercise protocol, you need to be at 80% of your target heart rate with no symptoms. Okay. We don't wait till you're there to start doing other neuro activities, right? So this is where you can start to ask questions, right? So when you look at some of the research, it says that if there's these vestibular ocular motor findings, they can spontaneously resolve within the first 10 to 14 days. Cool. So we're giving you those exercises on day 4. So why would we wait to see if something didn't heal and then treat it?
Yeah.
As opposed to we identify it in our screen and give it to you then, because it's not going to hurt you.
No.
And it's probably going to help you.
Yeah.
So we don't love the let's sit back and wait.
No. And I think that goes back to what you talked about before as well, where if we're just sitting and waiting for, let's say, 10 days, well, that's 10 days where that patient's body and brain has the ability to compensate.
Yes.
And then, sure, on day 10, maybe you're not complaining of eye strain, but why? Did it actually spontaneously resolve, or are other parts of your brain and your nervous system just compensating?
Yeah. And so I think, because again, I can't be succinct, you guys. This does not work. Okay. So we have the rest. So we remove from play.
Yes.
40, 72 hours.
Yes.
Right? We talked about what rest is. You're getting into a clinic day 3 or 4, at least under day 7. We're doing an exercise test to help guide you for the return to aerobic activity because we want that going ASAP. And then we're also screening for those 7 profiles.
Yeah.
Upon identification of those 7 profiles, we are immediately beginning specific therapeutic exercises to help rehab that profile. Now, this would kind of fall into, and let's be real, like we try to make some of those exercises as soon as we can sport specific in that phase. So this takes up that kind of light activity, moderate activity, specific drill window, right?
Yeah.
Of the return to play protocol. When do we clear someone for non-contact practice?
Yeah. So again, they have to have gone through that exercise protocol where we know that they can get their heart rate up within those guidelines. In a non-contact practice, yes, sure, you've taken away the at least higher probability of contact. However, you're still giving that full effort, right? And so we need to make sure that that's a go. And then they're progressing through their neuro exercises.
And are they allowed to have symptoms in non-contact practice?
No.
But we can ask, like, oh, I just got a little bit of a headache. I'm good, right? No.
No.
Did you normally get a little bit of a headache? No? Then no.
Yeah, and it is, I mean, I laughed a little at that question, but it is true. The number of patients that come in and yeah, it was good. It was not too bad. Just a mild headache or a little nauseous later. I was like, well, that's not normal.
Yeah.
Right?
I was like, oh, my brain just felt a little foggy, but like, that's fine.
Yeah.
Did this happen before?
Yeah.
Well, no. Then no. Like, it's no symptom exacerbation when we're looking at return to play.
Yeah.
And so now, I actually don't know if you do the same thing here, but like, this is where I err on the side. Like, I'm a pretty conservative therapist, to be honest. Like, I will challenge you. I will push you. But when it comes to clearing you for sport, I want to make sure you're fucking ready. Again, you have one brain. So when I start to clear my athletes for return to sport, I want 2
So do I.
successful non-contact practices where you've gone all out and
Mhm.
done the other specific drills and you feel good. And then from there, we'll clear you for contact. I want 2 solid non-contact practices. And the other piece I think that is so important in this window and where it's really important for us to touch base with the coach and stuff after the non-contact in this phase is athlete confidence.
Yeah, and you come over that a lot, right? Where in clinic they might be doing great. And maybe in those non-contact practices they did great in the sense of it didn't flare up their symptoms, they could do it, etc. But then in that visit, when you talk about all of these boxes are checked on my end to clear you for contact, but sometimes they're just not ready. They're nervous, they're scared, they don't think that, like, mentally they're just not there. They don't know if their body's ready or not, and I think that that's something that's very important to also listen to, right? Because if
Mhm.
you're not ready for it, like, you're just putting your body at greater risk
Absolutely.
by going into that environment, right?
Yeah. And we don't want to do that. And so that's
No.
where things like if you depending on the relationship you have with your
Yeah.
coach, or that's where sports psychologists can come
Yeah.
in, mental health performance coaches. It's a really real thing. I mean, it happens with people who come back from ACL and go back to sport, right?
Yeah.
Like it can happen with every injury, but if we don't have exactly like you said, like if we don't have that confidence, you are putting yourself at
Yeah.
higher risk of any injury, not
For
just
sure.
another concussion, right? So that is ultimately the return to play process. Now, timeline wise, this is always the golden question, right? How long does this take? Well, honestly, a piece of it depends on if there's exercise intolerance.
Yeah.
So, exercise intolerance is what we talked about with you're getting symptoms when your heart rate elevates. Okay. If you have exercise intolerance, your recovery is going to be longer.
Yeah.
No questions. I would say if you have exercise intolerance, you're looking at least a 2-week window
At the minimum.
at the minimum.
Yeah.
Yeah. If you don't have exercise intolerance, but you're falling into like one of those other profiles, then it could be faster,
For sure.
right? Like we've definitely cleared people within a week or 2
Mhm.
that didn't have exercise intolerance. Is almost always 2 to 4 weeks,
Mhm.
I think. When
Yeah,
I can make it
I
so.
would say so. Yeah.
So let's talk about the factors here. The length of time it takes you to return to play is absolutely part of it based on your initial presentation, right? If we know there's dizziness right away, if there's headaches right away, if there's exercise intolerance, those are factors that are typically going to have a little bit, not always, but they're a flag for us that recovery might take a little bit longer. But what you do at home outside of the clinic absolutely will either help you or hinder you on the recovery as well. So let's talk about the things that they can do, Rach, that would help them
Yeah.
in this recovery.
Yeah. So, well, that's loaded question. There's a lot, right, that they can do. And I think that there's stuff that will help in terms of management. So whether it's the nervous system things that we talked about, the breathing, etc., that will help in terms of regulation and management. Those are all great things to do. And then it's like we talked about, it's the not continuing to do nothing and just sit in a dark room, right? It's based on the guidelines you've kind of been given by your therapist, doing that movement, doing that exercise, making sure your body is moving so we can get the blood flow back to the brain, help recovery, along with all the other kind of neuro exercises or therapeutic exercises that we've given them. And then it's listening to your body and listening to your symptoms, right? It's not pushing in so that you're doing too much every day and you're kind of overdoing your capacity. You're taking your time with it, you're listening, and yeah, I think that those are kind of the main broad things, right? It's not pushing too far and it's doing everything you can to help manage.
So I'm going to layer some more things in here for sure. First of all, Rachel said about like not pushing through those symptoms. That's huge. If you blast through your symptoms and ignore your symptoms, you're actually going to set yourself back.
Yeah.
So that's a hinder thing for sure. Other things that we know can support you in this healing process in this early stage, your nutrition is key.
Sleep.
You are in an inflammatory process of your brain, right? So in these first bits, really focusing on clean nutrition will be your best friend. So stay away from processed foods, stay away from fast food. Honestly, you might not be someone who has gluten or dairy intolerances. Concussions can trigger funky things sometimes. And so just to err on the side of caution, I say like stay away from gluten for a month. You might be somebody that it has zero effect on you whatsoever, or you might be someone like me that it's horrible. So it's really clean nutrition in that beginning. It's super important. Also, really making sure you're getting your amount of protein in your body. Super important. Sleep is huge, and sleep gets impacted in up to 70% of individuals after concussion. So we get that this can be hard, but really as quickly as you can, getting on a regular sleep schedule. Bed at the same time, waking up in the morning at the same time, really setting up a sleep hygiene schedule. If you're starting to notice any difficulties with sleep, start those habits early, and your therapist can walk you through sleep hygiene. And I'm going to say there's again many things, but like nutrition, sleep, it's outside of our scope of practice. There are supplements you can take that support kind of the inflammation and healing process. Again, there isn't hard research to support whether that does help. I fall into the camp of if it's not going to harm you, why not try it? And then thirdly, I'm going to say like who you surround yourself around really matters. People that you can talk to, that you can share your frustrations with, but that also like pick you up and support you. Like, so those are other factors in addition to what Rach said that absolutely will help you on this recovery process. So let's do the other switch and talk about, we kind of touched on already, about like the things that will hinder or prolong the recovery process. So like you talked about already, like pushing through those symptoms, this is going to make the whole thing longer. Staying in that dark room, it's going to make things longer.
Yeah, all the opposite things is what you said, right? If you're not sleeping, if you're eating shitty, all of these factors are just going to, they're not going to help.
I'm going to say if you also, like if you're in the woe is me, I'm a victim, this is shit, why did this happen? You're allowed to feel those feelings.
Yeah.
But then move on. And if you're having a hard time moving past that or moving past anger, if it's like, say this happened right before a huge fucking game and there was going to be scouts there and like, and now you can't play. I can appreciate why you would be angry. You cannot live there.
No.
There are certain emotions that when you start to look at research impact your physiology. And so living in anger, living in that victim mindset, living in the woe is me is 1,000 million numbers going to hinder your recovery. Feel it. Acknowledge it. Share it with somebody who can be your sounding board and then find a way to move through it. Yeah. That's kind of like when I think of return to play in a really broad way. Those are kind of the pieces.
Yeah, I would say so. I think we hit on how to screen, what red flags are, difference between sideline and in clinic, and then how do you get back to the sport and do what you love.
Yeah. I mean, I'm going to throw like, there's a thing of like suspected concussion in there. So let's just hit on that real quick. So not a confirmed concussion, but like you're on the ice or whatever field it is, and there's a possibility of concussion. Ultimately, you want to pull that person for 24 hours. Again, it falls into that better to be safe than sorry category. So you pull them, and within 24 hours, if symptoms haven't developed, then they're probably fine and they can go back to things. But really, when you look at the protocols, it is you are removing from play with a confirmed or suspected concussion.
Yeah. And I think that's one of the tough parts. And that's why conversations have to continue to happen, because I know 10 years ago or even now, lots of teams that's not the case, right? And yeah, without the education, without conversations happening, it's hard to make that change. So I think, it's continuing to preach and
sound like a broken record.
Yeah,
really. I realize we didn't talk about baseline testing, so super quick. This could be a whole other baseline testing could be its whole other episode. Maybe we'll do that, but baseline testing is basically you're doing a preseason test for function, cognitive, balance, all those pieces. And then the theory is that someone has a suspected concussion, you would confirm it to their baseline to then see where they're at to help clear to play, right? So the problem, I'm not opposed to baseline testing. Now, our baseline test is unlike any normal baseline test. We pull the technology in from our clinic. We really do screen and baseline for those 7 profiles and for full neurofunction, because the other piece of it is that baseline test can show you where there's weaknesses to then train for neuro performance, right? Which is not a typical way people think of baseline testing, to be honest. But like when you think about it, if you are an athlete, that 0.5 of a millisecond in reaction time matters.
Oh, yeah.
Right? Like that processing speed, if you can process that much faster, you can move faster. You can do all these things. And so baseline testing, if you see a clinic that does more than an app, full disclosure, really, you have this opportunity to also have this picture on, okay, what is my level, which is the whole point of a baseline test. But then where is there room to improve? Where is there room to do some work that I can like up my level as an athlete too? That's why I love baseline testing. It's like, let's use it for more than just a comparison for if I get a concussion, because a baseline test also doesn't diagnose a concussion.
No.
Right? Any other thoughts you want to add about baseline testing?
I think you hit most of it, right? I think at the end of the day, I'm also not against baseline testing. I don't think it's a bad thing if it's used in the right way. That being said, 90% of patients I see or we see with acute concussion don't have a baseline test. And it does not change my approach to treatment or care.
That's a solid point.
It just doesn't, right?
Yeah.
So yeah, they're good. They can be good. I do like the neuroperformance aspect of it too, where whether it's from baseline test or just our kind of full assessment, it's patients that are coming in, whether they've gone through a concussion and their parents are like, hey, like they have much better reaction time than they used to. Like, can we keep coming in?
Oh my gosh, that happened. I remember. Oh, frick. And this happened so many times with our athletes that come through. And because again, we don't know what their performance is before their concussion. And I remember I was working with this hockey team for a while. And good God, were they getting concussions? And the coach said to me, they were like, he's better than before his concussion. And it's like, well, it's because that. Yeah.
We're looking at everything, right? And we want to optimize. We don't just want to have people like do okay or do good, right? We want them to kind of know where those deficits are, tell them where we can help, and that'll cross over onto the performance side as well.
It's like that speaks into the whole like why our clinic is called Symphony Brain Performance, because we span that spectrum of rehabilitation to optimal living and function. And so any human being at any point can come in for an assessment on how their brain is doing, and we will guide you with tools and exercises and some of our fun tech on how you can optimize your brain function. And that's like, it's such a fun piece of what we get to do as well. So good point. All right, friends, this was totally not the 30-minute episode that we usually do, but that's quite all right. If you are someone who has questions about this, always feel free to reach out on Instagram at natasha.wilch. You can also send me an email. If you are local to our area and you are interested in what Rachel and I just described in terms of baseline testing or neuroperformance testing, reach out to the clinic. We are happy to help you. If you want to come over and do that, we're happy to help you too. But until next week, have an amazing day. That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.